So today we will run through 5 different cases of primary and secondary Sjogren's and what different modalities we took to manage each of them. So it's basically going to be a pictorial run through. So the first patient was a 50-year-old patient with dry eye symptoms on all the possible over-the-counter medications. On asking, she had joint stiffness and pain. So we investigated her for collagen vascular diseases, and she had a lot of inflammatory markers. Rheumatoid RA factor was positive, ANA was positive. So on referral to the rheumatologist, he started her on immunomodulation. So coming to the local management, sodium hyaluronate is a good option. Paraffin-based ointments are very symptom relieving for these patients. A course of anti-inflammatory are preferred as steroids, and an oral pilocarpine again is quite useful. And most important is to encourage them to follow the treatment given by the rheumatologist, as only a control of systemic disease can help us manage the eye better. So again, she was very good after 2 months, and a very significant improvement was seen. The second patient, again with similar complaints, a 55-year-old, again symptomatic for more than 10 years and presented with gradual loss of vision with a mad cat. So her ocular surface looked like this, and after a surgery she looked this good. So what did we do? We combined her cataract surgery with a punctal cautery. Yes, an element radiofrequency was used to permanently cauterize her punctum. It comes with a handpiece and different probes which we can use for punctal cautery. And this is her pre-op puncti, immediate post-op and 2 weeks after surgery. And the results can be quite dramatic. So she was so happy that she immediately went ahead with the other eye cataract and punctal occlusion. So this is a very promising treatment for Sjogren's. The next patient was a 40-year-old female, again symptomatic for 3-4 years. The only positive history she gave systemically was that she was on infertility treatment and already on all possible medications with the low Schirmer's of 3. So again, on investigating, she was picked up to have rheumatoid arthritis and referred to the rheumatologist for the same. For the eye, we planned silicone punctal plugs for her. The different plugs that are available today, the lower one is the soft plug by the Oasis, a very elegant OPD procedure. Anesthetize, dilate the punctum and insert this punctal plug with very satisfying results, and this is her 6 weeks post punctal plug insertion. And the happiest part was that she came after 3 months with a box of sweets saying that she had conceived. Yes, probably rheumatoid arthritis was the reason for her infertility, and once that was cautive, she immediately conceived. And coming to the next patient, this was a very elderly lady, 65 plus, symptomatic. She was an ayah or a clerk in a nearby school, and she was so photophobic that she could not even apply the drops by herself during her working hours. So we went ahead with scleral contact lenses in her. Today, with the advent of a lot of Indian companies who manufacture scleral lenses, they have become much more economical, and this has surely been life-changing for her. Her daughter applies the lenses in the morning, and once she's back from work, removes it. So again, with the advent of OCT, fitting scleral contact lenses has become much more simpler and predictable. So again, a dramatic change in her eye. And the last patient was a male, 45-year-old, again with a very bad ocular surface and had primary Sjogren's. So in him, we opted for using his own blood to make serum eye drops. So just collect the blood, centrifuge it for around 15 minutes after a resting time, and you can prepare drops from 10% to 100% depending on your indication. Again, works beautifully well in such patients and a much quieter and silenter ocular surface. So I would end it by saying every dry eye has a story to tell, and today there are so many options that you can provide for all your severe dry eye patients. Thank you so much.